As readers will recall from the earlier article, Japanese and Taiwanese epidemiologists and pharmacologists have determined that the new coronavirus almost certainly originated in the US. As readers will recall from the earlier article, Japanese and Taiwanese epidemiologists and pharmacologists have determined that the new coronavirus almost certainly originated in the US, since that country is the only one known to have all 5 types, from which all others must have descended. Wuhan in China has only one of those types, rendering it an analogy as a kind of branch which cannot exist by itself, but must have grown from a tree. The Taiwanese physician noted that in August of 2019 the US had a flurry of lung pneumonias or similar, which the Americans blamed on "vaping from e-cigarettes," but which, according to the scientist, the symptoms and conditions could not be explained by e-cigarettes. He said he wrote to the US officials telling them he suspected those deaths were likely due to the coronavirus. He claims his warnings were ignored. Immediately prior to that, the CDC totally shut down the US military's main BO lab at Fort Detrick, Maryland, due to an absence of safeguards against pathogen leakages, issuing a complete cease and desist order to the military. It was immediately after this event that the "e-cigarette epidemic" arose. Screenshot from the New York Times, August 8, 2019. We also had the Japanese citizens infected in September of 2019, in Hawaii, people who had never been to China, these infections occurring on US soil long before the outbreak in Wuhan, but only shortly after the locking down of Fort Detrick. Then, on Chinese social media, another article appeared, aware of the above, but presenting further details. It stated, in part, that 5 foreign athletes or other personnel visiting Wuhan for the World Military Games, October 18 to 27, 2019, were hospitalized in Wuhan for an undetermined infection. The article explains more clearly that the Wuhan version of the virus could have come only from the US, because it is what they call a branch which could not have been created first, because it would have no "seed." It would have to have been a new variety spun off the original "trunk", and that trunk exists only in the US. 1. There has been much public speculation that the coronavirus had been deliberately transmitted to China, but, according to the Chinese article, a less sinister alternative is possible. If some members of the US team at the World Military Games, 18th-27th October, had become infected by the virus from an accidental outbreak at Fort Detrick, it is possible that, with a long initial incubation period, their symptoms might have been minor, and those individuals could easily have "toured" the city of Wuhan during their stay, infecting potentially thousands of local residents in various locations, many of whom would later travel to the seafood market from which the virus would spread like wildfire, as it did. That would account also for the practical impossibility of locating the legendary patient zero, which in this case, has never been found, since there would have been many of them. Next, Daniel Lucy, an infectious disease expert at Georgetown University in Washington, said in an article in Science magazine that the first human infection has been confirmed as occurring in November 2019, not in Wuhan, suggesting the virus originated elsewhere and then spread to the seafood markets. One group put the origin of the outbreak as early as the 18th of September 2019. 2. 3. Wuhan seafood market may not be source of novel virus spreading globally. Description of earliest cases suggests outbreak began elsewhere. The article states, as confirmed cases of a novel virus surge around the world with worrisome speed, all eyes have so far focused on a seafood market in Wuhan, China, as the origin of the outbreak. But a description of the first clinical cases published in The Lancet on Friday challenges that hypothesis. 4. 5. The paper, written by a large group of Chinese researchers from several institutions, offers details about the first 41 hospitalized patients who had confirmed infections with what has been dubbed 2019 novel coronavirus, 2019 nCoV. In the earliest case, the patient became ill on the 1st of December 2019, and had no reported link to the seafood market, the authors report. No epidemiological link was found between the first patient and later cases, they state. Their data also show that, in total, 13 of the 41 cases had no link to the marketplace. That's a big number, 13, with no link, says Daniel Lucy, 6. Earlier reports from Chinese health authorities and the World Health Organization had said the first patient had onset of symptoms on the 8th of December 2019, and those reports simply said most cases had links to the seafood market, which was closed on the 1st of January, 7. Lucy says if the new data are accurate, the first human infections must have occurred in November 2019, if not earlier, because there is an incubation time between infection and symptoms surfacing. If so, the virus possibly spread silently between people in Wuhan, and perhaps elsewhere, before the cluster of cases from the city's now infamous Huanan seafood wholesale market was discovered in late December. The virus came into that marketplace, before it came out of that marketplace, Lucy asserts. China must have realized the epidemic did not originate in that Huanan seafood market, Lucy told Science Insider, 8. Christian Anderson is an evolutionary biologist at the Scripps Research Institute who has analyzed sequences of 2019 nCoV to try to clarify its origin. He said the scenario was entirely plausible of infected persons bringing the virus into the seafood market from somewhere outside. According to the Science article, Anderson posted his analysis of 27 available genomes of 2019 nCoV on the 25th of January on a virology research website. It suggests they had a most recent common ancestor, meaning a common source, as early as the 1st of October 2019. 9. It was interesting that Lucy also noted that MERS was originally believed to have come from a patient in Saudi Arabia in June of 2012, but later and more thorough studies traced it back to an earlier hospital outbreak of unexplained pneumonia in Jordan in April of that year. Lucy said that from stored samples from people who died in Jordan, medical authorities confirmed they had been infected with the MERS virus. 10. This would provide impetus for caution among the public in accepting the official standard narrative that the Western media are always so eager to provide, as they did with SARS, MERS, and Zika, all of which backquote official narratives were later proven to have been entirely wrong. In this case, the Western media flooded their pages for months about the COVID-19 virus originating in the Wuhan seafood market, caused by people eating bats and wild animals. All of this has been proven wrong. Not only did the virus not originate at the seafood market, it did not originate in Wuhan at all, and it has now been proven that it did not originate in China, but was brought to China from another country. Part of the proof of this assertion is that the genome varieties of the virus in Iran and Italy have been sequenced and declared to have no part of the variety that infected China and must, by definition, have originated elsewhere. It would seem the only possibility for origination is the US, because only that country has the tree trunk of all the varieties. And it may therefore be true that the original source of the COVID-19 virus was the US military biowarfare lab at Fort Detrick. This would not be a surprise, given that the CDC completely shut down Fort Detrick, but also because, as I related in an earlier article, between 2005 and 2012 the US had experienced 1,059 events, where pathogens had been either stolen or escaped from American bio labs during the prior 10 years.